In today's mental health check, we're shining a light on pregnancy loss. It's a topic that sometimes is difficult to talk about, but it's more common than you might think. Up to 1 in 4 known pregnancies end in the loss of a baby before the 20th week. And in addition to the physical toll, there's also an emotional, mental health toll as well that so many women do experience after loss. Joining me now, Dr. Lucky Sekhon, a board-certified OBGYN and reproductive endocrinologist, also with me, clinical psychologist and infertility expert, Dr. Georgia Witkin. Nice to see you both again. Thank you so much. I do want to say, I myself have talked about experiencing 2 losses. So Dr. Sekhon, starting with you, talk about some of the common mental and emotional symptoms that women might experience after a pregnancy loss, and how long can that last?
Even though they are a common occurrence, unfortunately, that doesn't make them any less difficult to go through. Many women who have experienced miscarriages will experience grief and depression, feelings of intense sadness. There's often anxiety about future pregnancies and guilt. There's a lot of self-blame, even when it's not warranted. And then feeling lonely and isolated. Often women may not feel comfortable talking to their regular support system, their friends and family members, because they feel a sense of shame and they're embarrassed, and that leads them to suffer these symptoms alone.
Yeah, Dr. Witkin, a few years ago, NBC did a series about pregnancy loss, which you can find on today.com. I'll post it on my social media. But myself and other women shared personal stories about what it means to experience that. And what advice do you have when it comes to that issue of talking about it and taking care of your own mental health?
It's the perfect question, because talking to anybody is not a good idea. You really have to select those you talk to so that when someone says to you, I know what you're saying, I understand, you believe them, which means you have to speak to people who either are specially trained. I do a lot of that for USF, for Progeny, for RMA of New York, but also there are national groups that'll help you meet other people who are going through the same thing, because the majority of people don't even mention that they're pregnant early on, and then when they have their loss, they feel isolated because nobody knew. Or even worse, they're so far along that if they don't see somebody for a while and now they're not pregnant, they're asked about the baby because nobody even knows that they had miscarried.
Yeah, that can happen. Dr. Sekhon, what are some signs that women should seek additional help for mental or emotional symptoms or support? And what resources are there?
So I think it's normal to experience the sadness and the anxiety and all of the things that can come along with miscarriage for weeks and maybe even a few months. But if this starts to become prolonged or extremely intense to the point where it's impairing your ability to function day to day and it's impairing your relationships, then that's a sign that you need help, particularly if there are thoughts of self-harm. That is an emergency. You need specialized care and support, and that's essential for your safety and for your well-being. And especially if you're feeling isolated and you don't feel like you can go to your normal support system in your life, your friends or your family members, that is a sign that you need professional help and you should seek support elsewhere.
Dr. Witkin, what if you're one of those friends or family members and someone who you love is experiencing loss? What's the best language, terminology? How do you talk about it?
We all try to find the perfect thing to say, and I'm here to tell you, you don't have to find the perfect thing to say. It's better to actually not do any cliches, any advice. Instead, be there, ask the person, how can I help you? And then very, very important, listen to what they say. Repeat it back to them so they can even hear themselves. So be there, and not just the first week and the first month, but the first birthday, the first anniversary. Help them process the loss.
Yeah, I find myself thinking about it just talking to you guys. Are there ways, Dr. Sekhon, that doctors can screen and help their patients, like really look for these depressive or anxious symptoms?
There definitely needs to be improved awareness. And I think we as a field are getting better at this, at incorporating mental health evaluations as part of routine healthcare appointments. Using standardized screening tools can be very helpful. Things like validated screening questionnaires. This is an objective way that you can assess mental health symptoms, and this may help to facilitate early identification and intervention.
I'm so glad that we could have this conversation. Thank you so much, Dr. Lucky Sekhon, Dr. Georgia Witkin. Great to have you both. There is much more news ahead. You're watching NBC News Daily. Don't